Before you start giving the injection, you'll need the following supplies: Enoxaparin bottle or Tinzaparin bottle, insulin 30-unit syringe, 50-unit syringe, or 100-unit syringe, alcohol swabs, cotton balls, and a sharps container. Before giving Enoxaparin or Tinzaparin, you first need to draw up the medicine from the bottle. Make sure to check the date on the medicine bottle to make sure it has not expired. To draw up Enoxaparin or Tinzaparin, first wash your hand with soap and water. Pick a clean and bright environment to draw up and give the medicine. For the first time, you'll need to remove the vial cover and write the date you first used it. Now clean the rubber stopper on the medicine bottle with an alcohol swab before each use. Wait a few seconds for the alcohol to dry. Remove the cap from the needle and syringe. Put the needle through the middle of the rubber stopper on the medicine bottle. Now turn the bottle upside down with the syringe in it. Ensure the tip of the needle is in the solution. Slowly pull down on the plunger of the syringe until you have a bit more than the required number of units. Your doctor or pharmacist will tell you what dose your child is going home on. For example, if the amount of your child's medicine is 11 units on the syringe, pull the plunger below 11 units and push it back up. Ensure the top of the black plunger is aligned with the unit. It is best to do this at your eye level. It may not be accurate if you have to look up or look down at the syringe. Check the syringe for any air bubbles. If there is a large air bubble, pull back on the plunger again. Then push it slowly back into the syringe until the air bubble is gone. Please note that it is not harmful to inject an air bubble under the skin. However, if you're injecting air rather than medicine, your child may not be getting the full dose, which may mean they are not being properly treated. Repeat until you have the desired amount drawn up. Now lift off the medicine bottle from the syringe. Be sure not to touch the exposed needle to any surfaces. It is now ready to be given to your child. Put the cap back on the syringe if you're not giving the medicine immediately. Safe areas of injection include the thighs and the upper arms. Do not use the buttocks. If you have concerns about where to inject the medicine, ask your doctor or nurse. For the thighs, proper areas are the top, front, side, and outer parts of the thigh. Do not use the inner thigh or the back of the thigh. Now divide the thigh into thirds. The injection site is in the middle third. For the upper arms, proper area is the fatty area on the side and back of the arm. This site is generally for infants older than 4 to 6 months of age. Now divide the upper arm into thirds. The injection site is in the middle third section. First, choose the injection site. Ensure the skin is clean. You do not need to use an alcohol swab. Try to change the injection sites with each injection you give. For example, inject into the left thigh in the morning and the right thigh at night, as right rhymes with night. Now gently squeeze up a well-defined fold of skin and fat with your thumb and index finger. Hold the shaft of the syringe in a dart fashion. Insert the needle directly through the skin at a right angle, quickly into the fatty layer. Move your hand into position to direct the plunger. Do not move the needle tip once it is inserted. Inject the medicine at an even pace. Firmly push the plunger down as far as it will go. Pull the needle out gently at the same angle you put it in. As you take out the needle, let go of the skin roll. Apply firm pressure with a cotton ball to the injection site for 3 to 5 minutes following each injection to reduce the chance of bruising. Do not rub the area as it may irritate the skin. Put the needle and syringe in a thick plastic bottle or a sharps container with a lid. This is for safety. When the container is full, bring it to your local pharmacy or local waste management department. They can safely dispose of it for you. Do not put it in your regular garbage can. Remember to keep the medicine bottle and the syringes out of your child's sight and reach and locked up in a safe place. Not every pharmacy keeps the medicine vials in stock on a regular basis. Therefore, please call your pharmacy at least 2 days before you run out of the medicine to order refills. You will also be given a prescription for the right size of syringes, which you can buy at any local pharmacy. A new needle and syringe must be used each time. Enoxaparin and Tinzaparin may or may not be covered by your private drug plan or the Ministry of Health. Please contact your healthcare provider if you need assistance.